It is a deadly disease that kills thousands of women each year. Tonight, how one organization is helping women discover their risk for breast cancer before any physical signs.
And the Night Team's David Douglas is here with this story. David?
Yeah, the Susan G. Komen Foundation here in Madison funds lots of initiatives, including providing the seed money for a UW Health clinic for patients who have an increased risk for developing breast cancer.
In life and on the road, Allison Cooley is putting one foot in front of the other.
So how many days are left of school?
She enjoys runs with her daughter Carlin, but concerned about breast cancer, she recently decided it was time for a genetic test to determine her risk.
My mom and my aunt were diagnosed within a month of each other in 1992 with breast cancer. And up until that time, we didn't have a family history, but then all of a sudden, like in a month period, and all of a sudden there's a family history.
Fortunately, she tested negative for 2 gene mutations doctors know raise risk substantially. But because of her history, she's now being seen at a UW Health clinic for women like her.
Everything we try to do in this clinic is balancing the risk of developing breast cancer in lifetime against some of the interventions that we have to reduce that risk.
Cooley's doctor, Carrie Wazinski, says they now have real options, including new drugs, to give women a fighting chance, even if they're most at risk.
These are medications that have been shown to reduce the risk of breast cancer pretty significantly, but in themselves have other risks.
I'm not doing tamoxifen because of the side effects, so I'm going to be doing the breast MRI every year and then mammograms every year, so that's alternating every 6 months then.
She takes comfort in care she feels is both compassionate and complete.
Better than any place I've ever been. I mean, name a time that a doctor spent an hour explaining something to you. I mean, I don't think I've ever had that before.
It's good to know, like, if anything does go wrong, they'll catch it right away, and like there's treatment and stuff.
And Cooley's daughter is relieved too, helping her focus on the race of life. She loves running with her mom.
I'm glad. Monday is a skinny day.
Many insurance companies will now pay for breast MRI. Dr. Wazinski says it's especially good for women with more dense breast tissue, younger women. The downside is it has a lower specificity, so it's more likely to find things that don't turn out to be an actual cause for concern upon further testing.
Well, I know a lot of people have talked in the past about insurance, speaking of that it would impact insurance premiums. Is that an issue with this one?
Laws no longer allow insurers to discriminate on the basis of a genetic test. That's speaking of health insurers, but those findings can affect life insurance and disability insurance premiums down the road.
All right, News 3's David Douglas reporting tonight. David, thank you very much.